we're going to do now is look at the Tourni-Key Plus. Now, this is a very simple to use tourniquet that you can use on any catastrophic bleed from a limb. So the kit itself is all in this bag here. You can either buy these as an individual bag, all sealed up like this, or we also sell these as parts of bleed kits. So we do an economical bleed kit and we also do others, or you can have multiple packs of these. So if you're in a location where potentially there could be a terrorist attack or a gunshots or knife wounds and you might need lots of tourniquets, then you can have lots of these in one pack. On the side is a little nick, so you can very easily just tear it open. Once you've torn it open, just pull out the contents. And what you've got are three bits. There's the main instruction card here. And in the instruction card, it tells you all about how to use the tourniquet. And then if you open it up, there's more information in there exactly how to use it. So with the instructions, they're very simple picture diagrams. The tourniquet itself is a very strong plastic. It may look a bit odd, but it's a very simple way of tightening a piece of material around a limb. Now, you could use something like a tie or something like that, but you don't really want to use something very tight that's going to cut into the skin, because it literally will. You can get a lot of pressure. The whole point of putting this tourniquet on is to stop a bleed. So in this example here, we've got someone with an amputation. So we need to put the tourniquet on to stop the bleed. So you will need to crush through the tissues of the body in order to block off all of the arteries and the venous return to stop that bleed. The final thing in the pack is a triangular bandage. And this is just a standard bandage, which is the material type of bandage. So this would just unwrap, and then you've got yourself the main triangular bandage. So once you've got your triangular bandage out, then you need to open it up. And you open it up so you've got the long end, so there's the 90-degree corner at the bottom, and then just roll it up into what they call a broad fold bandage. So you literally just go through this and just wind it around until you've got no more to wrap up anymore. And then what we need to do with that is place it around the limb. Now for this example, we've got a limb here, so you want to put it just above the limb that's been amputated. We don't want to ever put these over a joint. Pull it through in a half knot and just tie that securely. And then you're going to be putting a lot of pressure on here. So they have a little card that you can tuck underneath the bandage. So you just slide that underneath. That will just avoid any risk that when they tie the knot on, it's going to pinch too much onto the skin. We then need to take the tourniquet. We need to just secure that in place. So if you've got two people, you can get your helper to do this. But what we'll do is just tie it up, and we're just tying that in place. So it's literally going across here, and then we can always just tie it on again. So that's now in place. So what you're going to do then is you're going to wind that around and apply pressure. Now this is on a mannequin leg. If it's on a real person, as you wind it around, it will dig into the skin and cut the circulation. It won't do it so much on this one. So you literally just wind that around, and you can get a lot of pressure on this until it's tight. So once it's tight, as we've got now, take this end here, and we're going to just tuck it underneath the bandage. So once it's gone through, then tuck it back in place. Now this is easier to do on a real person. The problem with these legs is there's not much give in them. So that's now secured in place. It's tucked underneath the bandage. The tourniquet is on. If we needed to apply more pressure, we can turn it around another 180 degrees and tuck it in on this side, or another 180 degrees and tuck it back over here. You tighten it up until the bleeding stops. So you will see that the bleeding stops. The other key thing we need to do now is we need to note the time that it's gone on. This is important. So you can write the time, you can write it on the patient's forehead, on their head or somewhere, or at least note it down somewhere, because you do need to tell the EMS what time this went on. Once it's on, you need to stabilize the patient. You need to treat them for shock, you need to be with them, you need to talk to them, you need to communicate. This is going to be a very scary thing. It's going to be painful as well. But once that's on, you tell them how important it is to put this on, because we must keep as much of this blood in the body as possible. Whole time that you're waiting for the EMS to arrive, just keep an eye on the limb, make sure it's not started bleeding. If it is, you can apply more pressure on, or you can always put another tourniquet on above this one, but remember, you do not want to be going over a joint. So if it's close to the bottom of the knee, the only place you can put it is higher up, then you need to put that higher up.